Hello everyone, today you will be watching our presentation of global aphasia. You will see a client and a clinician go through the phases of informal and formal assessment, counseling, and treatment. As for the case history of our client, her name is Barbara Green, and she is a 55-year-old English-speaking right-handed female with a high school diploma. Mrs. Green is married to her husband Robert Green and has two teenage sons, Connor and Dylan. She is a secretary, and Mr. Green served as Mrs. Green's healthcare proxy to provide this information. It was reported that Mrs. Green had a medical history of hypertension, hyperlipidemia, excessive alcohol consumption since she was in her 40s, and juvenile diabetes. On November 30th, 2021, Mrs. Green arrived to the emergency room of St. John's Hospital via ambulance after a 911 call was placed by Mr. Green, who had reported his wife complained of a throbbing headache, reported blurry vision, experienced a loss of damage, had slurred speech, and stopped responding appropriately to questions. Mrs. Green was immediately rushed to receive a CT scan. The etiology of her damage is an intracerebral hemorrhage at the branches of the circle of Willis, and the site of lesion is extensive left hemisphere cortical damage in the region supplied by the middle cerebral artery.
All right, hello Ms. Green. I am Christina. I am your speech language pathologist. I'm going to ask you to repeat a few things after me, okay?
Baba.
All right, so can you tell me the words sock, blue, and bed?
Back, don't know.
All right, so sock, something you wear.
Back.
Right.
Back.
Yes, sock, something you wear. Blue, a color. And bed, a piece of furniture.
Back.
All right, so sock, blue, and bed. All right, so can you tell me what year it is?
Yeah. Baba.
All right, and can you tell me what month we're in?
Don't know.
Okay, and can you tell me what day of the week it is?
Baba.
All right, and back to my previous question. Can you repeat all three words that we had talked about?
Back.
Okay. It was something to wear, a color, and a piece of furniture.
Don't know.
All right. So the words were sock, blue, and bed.
Back.
Yes, sock. All right. All right. Thank you so much, Miss Green. I'm going to get your nurse, and I will see you soon.
Bye.
Good afternoon. All right. Are you Miss Anderson?
Baba.
Are you Miss Green?
Yeah.
All right. My name is Christina. I am the speech language pathologist, and your doctor asked me to talk with you to see how you're coming along. So, how are you feeling?
Fine.
All right. What happened to you?
Don't know.
Did you say you had a stroke?
Baba.
Did you say you have a car accident?
Baba.
All right. Is this St. John's Hospital?
Baba.
Is this St. Mary's Hospital? All right. I was wondering how old you are. Are you 75 years old?
No.
Are you 55 years old?
No.
Okay. I was wondering where you live. Do you live in Pennsylvania?
Baba.
Do you live in New York?
Don't know.
I want you to do what I tell you to do. Close your eyes. All right, you can open them. Open your mouth. Okay, thank you. Can you show me your teeth? Stick out your tongue. Alright, now I want you to take a deep breath and say ah and hold it until I tell you to stop. Okay, you can stop. Can you sing row, row, row your boat? Alright, thank you. Now I want you to say what I say. No.
Ba.
Money.
Ababe.
Pizza.
Ba.
I love you.
Abavu.
Why not?
I don't know.
Alright. Can you show me how you salute the flag?
Ba.
Alright. And can you show me how you shake your finger at a naughty child? Okay. How many is this? Okay. Now, what is this?
A boom.
Can you show me how to use it?
Ba.
Alright. And now, what is this?
A babas.
Can you show me how to use it? Alright. Thank you very much. Can you please have those? Thank you. Alright. So, we have two pictures right here. Which picture shows this?
Bab.
Okay. And now which picture shows this?
That.
Alright. Thank you. What is he doing?
Baba.
What is he doing?
Baba. Ba.
Alright. And what is this person doing?
I don't know.
Alright. Which one shows sleeping?
Baba.
Which one shows drinking? Alright. Okay. So, tell me what this says.
Ow.
Okay. Tell me what this says.
I love boom.
Okay. And can you tell me what it says? Oh, okay. Can you tell me what it says?
No.
Okay. Alright, thank you.
No.
Alright, so for this next activity, I want you to draw a picture of a man. Alright? Can you draw a picture of a man?
Yeah.
Alright, that's beautiful. Okay.
Baba.
So over here, it says that you finished the test and that you understand that the test results will be used to make a better plan for your rehabilitation program. Can you please sign your name on the dotted line?
Yeah.
Alright, thank you. Alright, goodbye.
Bye.
Alright, as SLPs, why is the counseling an important role to consider when treating people with aphasia? Well, before stroke, people with aphasia were just like you and I. They were independent members of the society. They had a job, a family, and a social life. However, post-stroke, everything changes for them. They struggle to communicate and socialize with others, are unable to provide for their families, which results in self-isolation and low self-esteem. that can give rise to depression, anxiety, guilt, anger, and other strong emotions. Studies report that people with non-fluent aphasia are more likely to experience depression and anxiety. Thus, it is important that SLPs consider language impairment within the context of the whole person. How? By providing with language treatment to help them become functional communicators and by acknowledging the feelings the client might be feeling during therapy. For example, if the client is feeling frustrated, mad, or just simply sad, reassure them that it is okay to feel the way he or she is feeling. Talking about their emotions will help them bring to the here and now, improve self-esteem, and increase effectiveness of therapy treatment. Because a positive mood and well-being, motivation increases, and language and cognitive performance improve. But when emotional balance is disrupted, cognitive performance may decline. It is important to remember that speech therapy can be demanding, and that depression or other emotions can impact the motivation, hopefulness, and energy levels needed to engage with treatment. Good afternoon.
Good afternoon,
Robert. Nice meeting you. My name is Ada. I'm the speech pathologist, and I'm here to discuss your voice current status. So we've run some assessment tests, and the test shows that she presents with a global-like aphasia, and the global-like aphasia impacts all her language abilities because the hemorrhage happening on her left side of the brain, and the lesion is really extensive. As the stroke just happened, and we've seen that the swelling of the brain is reducing, and blood flow has started to go back to normal, which supports the neuroplasticity, the connections of tissues to regain those connections again. During the assessment, she was very responsive, attentive, and she also was able to respond to gestures, and that's what is the reason we picked her for treatment. Do you have any questions?
I don't know, man, I'm just confused. She usually talks a lot, she loves to talk. My kids and I we're concerned. We wanna know what's going on.
So, as I said, the global aphasia, it's impacting her abilities to express herself, understand, and even read short phrases. But with treatment, as I said, she will be able to make some improvements on areas of those languages impacted.
Okay. Alright.
Do you have any other questions?
No, I think it's just overwhelming. I don't know.
I see that you're frustrated, but if you have any other questions, you can always call me or email me, and I'll be here to support you on this process of recovery.
Okay.
Alright,
what was your name again?
Ada.
Ada, nice to meet you. I'm Robert.
Alright,
I'll go tell my kids. Thank you very much.
Bye.
Hello, Mrs. Green. My name is Danielle, and I am a speech-language pathologist, and I will be working with you today. How are you doing?
Yes.
Great. So I just want to briefly go over with you the results of the informal and formal testing that you took earlier. Is that okay? I noticed that you were able to communicate through the use of gestures, which is great. I also noticed that you were able to express yourself or what you wanted by drawing. Does that help you?
Yes.
My concerns are that you had difficulty understanding the questions being asked and appropriately responding to them during the formal assessment. Ultimately, the goal is that we want you to be an effective communicator, and that will be the focus of your treatment, to get you to become an independent and effective communicator.
Visual Action Therapy, or VAT, is a nonverbal treatment program which ultimately enables patients to produce symbolic gestures for visually absent pictured object stimuli. It is divided into 3 levels, level 1, 2, and 3, each containing different amount of steps. For the purpose of this video, we focus on level 1. In the following clip, we will demonstrate Level 1, Step 2 of the Visual Action Therapy, which is picture-object matching.
So we're going to do an activity where I will hand the patient an object and they have a corresponding picture in front of them, where they have to place the object on the corresponding picture. So Mrs. Green, I'm going to hand you one of these objects and I want you to place it on the corresponding picture in front of you. Great.
Don't know.
Do you know what this is, Mrs. Green? So it's a toothbrush that you use to brush your teeth.
Yes.
So which picture do you think is a toothbrush? So that's a fork. That's something you eat with. Great job.
Yeah.
Great. Great job, Mrs. Green. You did great. So for this next activity, I'm going to show the patient once again the same picture cards, but this time I'm going to have them demonstrate their functionality through the use of gestures. So Mrs. Green, I'm going to show you the same set of pictures again, but this time I want you to demonstrate the functional use of these objects. Great job. So remember this photo, which is what object? That's a comb, and you use that to brush your hair. This is a fork.
Bat?
Great job, Mrs. Green. Great job.
Bat?
Great, you brush your teeth. You can wash your hands and you can also use it in the shower as well. Great job, Mrs. Green. You're doing great.
Promoting aphasia communication and effectiveness, or PACE, is a multimodality approach that puts an emphasis on free choice of communication modality that incorporates the natural rules of communication.
So for the next activity, I have a stack of stimuli, picture stimuli cards that me and Mrs. Green are going to take turns flipping over and try to convey what is being represented on these picture cards to one another through any modality that we choose. So Mrs. Green, these are a stack of picture stimulus cards that we're going to each take a turn flipping over and do our best to explain what is being represented on the cards, whether that be drawing, if you want a gesture, or there is an AAC board that she can point to as well. Okay, are you ready to begin?
Okay.
Okay, I'll go first. What do you think I'm doing? You could draw if you need, or you can use your AAC board. So she is pointing to a fork, which is correct. Great job, Mrs. Green. You can go pick one now. Are you drinking something, Mrs. Green?
Yes.
Can I see the card? Great job.